In his famous novel, The Plague, Albert Camus writes, quote, "We learn in time of pestilence that there are more things to admire in men than to despise." You could say that about the coronavirus and the AIDS epidemic that started 40 years ago. On this World AIDS Day, it's estimated about 36 million people have died from HIV-related causes, and about 38 million people are living with the virus, and there is still no cure. Our chief medical correspondent, Dr. Jon LaPook, reflects on his own experience working at the height of the AIDS crisis. He went back to a place central to that time in his life.
In the fall of 1976, I entered medical school. I was eager to make a difference. But when you're a first-year medical student, you don't know a whole lot of medicine. So my contribution to clinical care was basically limited to bringing my college singing group to the hospital to entertain sick children.
I graduated in May 1980. And off I went to start my internship as a newly minted doctor at what was then called Columbia Presbyterian Medical Center. Then, in March of 1981.
Federal health officials consider it an epidemic, yet you rarely hear a thing about it.
I saw my first patient with what would become known as AIDS. He was suffering from something I had never seen before, an eye infection from a common virus that a normal immune system could usually handle. But his immune system was anything but normal. He died. And for years, so did every single patient with AIDS who I helped care for. So many of them were in what should have been the prime of their lives. They all had so-called opportunistic infections that attacked people with weakened immune systems. HIV, the virus that causes AIDS, would not be discovered for another 2 years. But we were all discovering firsthand that it could decimate the immune system.
We're all scared to death. We'd like to know what the hell we're supposed to do here. You know, what should we do? Should we stay home and lock ourselves back in the closet? Or, what should we do?
We don't know what we're dealing with, and it's deadly, and it's transmissible.
Wow. And it was right here, in this very amphitheater, where students and staff got together for what was called grand rounds, trying to figure out what in the world was going on. We all felt helpless, and I certainly didn't think I was making a difference.
I'm 31 years old, and I've watched a great many of my friends die.
Sometimes patients would get better, for a while, if their infections were treatable, but they would always get readmitted to the hospital.
I remember one man especially well, a car mechanic in Washington Heights, a husband and a father. A lovely guy who could not have been more grateful for the care we gave him, even though our care didn't prevent his death.
We want to live. That is all we want, America.
Then, in 1987...
For the first time, a drug to treat AIDS patients got final government approval today. The drug AZT is not a vaccine against the disease, nor a cure.
It was astonishing. Finally, some hope. And thanks to scientific research, the treatment gradually improved over the years, and HIV/AIDS became a more chronic, though often still devastating, condition.
Over the next 30 years, images of those brutal early days remained with me, but they mostly stayed in the background. Then, 10 years ago, I saw The Normal Heart, a gut-wrenching play about the early days of the epidemic. At the end, the names of people who had died of AIDS were projected on the walls of the theater.
I couldn't move, my eyes filled with tears, as the sadness of that time came flooding back. Those memories were a big reason why, in April of 2020, I helped out on the COVID wards at NYU Langone Health, where I'm a professor of medicine. I wanted to share what I had learned with the young students, doctors, and nurses who might be feeling as helpless as I did in 1981. They were way ahead of me. They had already arranged for their patients who were in isolation to video chat with loved ones, or kept them company by sitting at the bedside. They understood the therapeutic value of human touch, of reaching out and holding a hand. They also seemed to understand it was okay to shed a tear or two, and it was okay to take advantage of mental health services. Over the years, I've learned there are all sorts of ways to make a difference, and it's almost never something as dramatic as saving somebody's life. Much more often, it's by making their journey gentler. by showing them compassion and empathy, by listening, by being present.
Bravo, Jon LaPook. I'm telling you, he is, to me, one of the most empathetic, caring people that I've ever met. So it's no surprise to see early in his career that he was still that same person.
Yeah.
And his message is so important and so true.
Especially on this World AIDS Day, which was essentially created to unite everybody around the world to try and fight this deadly disease and to bring empathy to it.
My mom's brother, Uncle Ricky, passed away from AIDS in 1990. I was 9 years old. That forced us to become familiar with AIDS.
Yes.
And that familiarity turned into education.
Yep.
So that piece was awesome.
Remember in the beginning, we were so afraid. Nobody knew what we were dealing with. Thank you, Jon.
It was tough back then because no one knew what it was. No one knew what it was.